I love doing these seminars because I think the most important thing about the medicine these days is information. Patients who are well informed are much better patients because they understand what they're getting into, they understand the problem, they don't have to just make an appointment, but they can learn a lot about this from being here.
Let me introduce to you Dr. Mittal.
What we're doing. There's new technologies out there that can really help the patient. The new technology right now that we're discussing is what's called Mittal, which is a robotic assist partial knee replacement. Moderate to severe arthritis where they don't have terrible deformities. Now there's an option that we have that we didn't have before where we spare the ligaments, we spare a lot of the muscles, we do a very bone sparing technique, and they can still be out of a lot of that pain. Not everybody's a candidate, but if they have isolated disease, if it's just on the inside of the knee or just behind the kneecap, their ligaments are okay. It's not terrible arthritis where it's eroded the bone, but it's in just those stages where it's a transitional stage where certain conservative things aren't working, but they don't want to have a total joint replacement. Now we can use a robotic assist surgery, this Mittal, to come in, resurface that area, and they can get better much quicker and do a lot more because the knee will feel much more natural. When we can do the robotic assist surgery, we'll take a CAT scan of the patient. When we do this CAT scan, we upload that information into the robotic system. Now we have a 3D image of this patient, and we can exactly and very precisely put these components in so that it'll match that patient's anatomy, mimic it, and so it'll feel very natural. And then we can fine-tune those things when we're in surgery based on that patient's ligaments. The great thing about Mako is if we have an early intervention and we can do these replacements when they don't have horrible disease or horrible deformity, they can get 12, 15 years, maybe even longer with this, and potentially avoid the need for any major surgeries in the future. When you talk about new technology like robotic assist surgery, Mittal, I mean, these things were not available years ago, and now that they are, it's just another avenue to help the patients.